Hello, good afternoon, good evening, and good morning to everyone joining our live Q&A on mental health in emergencies. My name is Alexandra Kuzmanovic, and I am very pleased to be joined today by three of our mental health in emergencies experts, Fahmi Hanna, Brandon Gray, and also Selma Shevukli, who is joining us from Poland as she's been deployed in the response to emergency in Ukraine. We are in the third year of the COVID-19 pandemic, and it impacted all spheres of our lives, how we interact with each other, how we work, or how we are educated, just to name few aspects. And we've seen many media reports that the pandemic impacts people's mental health, and some of us have been impacted ourselves, or we've seen people dear to us who have suffered. So in that regard, WHO has conducted a study recently on mental health and COVID-19, on the impacts that the pandemic has on people's mental health. And Brandon Gray, who I mentioned, is actually expert behind this report. So today, as now I mentioned, we will talk about mental health in emergencies, and also the impact of different emergencies like the pandemic or conflicts have on people's mental health. So if you're watching us on Twitter, please use the hashtag AskWHO to ask your questions. If you're watching us on other platforms, please write your questions in the comment section and I will pass it on our guests. Good afternoon, Brandon, Fahmi, and Selma. Thank you for your time to be with us today. Brandon, please, sorry.
No, just saying, pleasure to be here. Thank you for the invitation.
Thank you, and thank you, Selma, especially to you as you are joining us from the deployment. Brandon, maybe as we can start with the report that we published a couple of weeks ago on the impacts that pandemic has had on people's mental health. So what are the key findings?
Thank you, Alex. I think we started this idea of the scientific brief with a number of questions, but there were five main questions we asked in the scientific brief, and these were the impact of COVID-19 on the rates of mental health symptoms and mental health conditions, the impact also on suicidal behavior and self-harming behavior in the general population worldwide, as well as in specific groups. We also were curious about the risk of people with mental health conditions prior to COVID-19 for having increased infection or complications or even hospitalization after infection with COVID-19. And then we asked what was the impact of the pandemic on mental health services and what was being done to respond to those impacts. I think we learned three important and key findings from this review, which was a wide review of several studies, actually. Number one, we learned that something I think we sort of already knew or expected, and that's that the pandemic has had a very large impact on people's mental health, and rates of common mental health symptoms like depression and anxiety have increased by as much as 25% worldwide. And those rates are even higher in some places where COVID-19 infection rates were higher or where movement was restricted. We also know that women and young people were more affected than men, though that's not to say men were not infected. There were also very high rates of increase in men as well. Second, I think we learned that people living with mental health conditions prior to COVID-19, they weren't at a higher risk of infection from COVID-19, but when they were infected, we learned that those people had a higher likelihood of having a severe illness from COVID-19, experiencing hospitalization, and even experiencing death due to COVID-19. So it really showed what we thought, that these people were at a higher risk and are an important risk group to be considering moving forward. And then lastly, I think the scientific brief taught us that services have been disrupted worldwide. We knew this, but it really showed that COVID-19 has shown a really bright light on the fact that there have been decades of underinvestment in mental health services worldwide, and that's led to even further gaps due to the pandemic. So we really learned we are seeing the decades of lack of investment and lack of priority for mental health playing out through COVID-19.
Thank you so much, Brandon, for this overview of findings. And as you just mentioned, there is a lack of investment in mental health care and services. So does WHO have any recommendations on how to increase support for people who need on institutional level, but maybe as well on individual level, how we can support each other more, or how we can recognize that somebody around us has mental health needs?
That's a great question, Alex. I think WHO has a lot of guidance for countries and how to strengthen mental health systems, how to integrate mental health care for priority mental health conditions in primary care settings, for example, and also from higher levels of care to community levels of care. So I think there are important strategies and tools that exist and are in place for countries. We just need to act on them. When it comes to the individual level, I think today we're talking about emergencies, and of course, whether we're affected personally by the emergency, we're watching from afar, we're seeing how people are impacted, or we're involved in the response. Suffering is suffering, and I think it's important to acknowledge that the reactions, the fear, the anxiety, the worry people feel, the worry that we feel is normal. Those are expected reactions to extraordinary situations. Now, that doesn't make the situation better. It doesn't make those feelings go away, but it can help with managing the stress and the anxiety and the fear, and it can help prevent the spiral. Of course, there are a lot of other basic strategies we can do if we are safe and protected. We can do things to take care of ourselves. We can manage stress through whatever it is that works for you. Whether it's yoga, stress management techniques like breathing or meditation, and we can ultimately be okay with needing to seek support and asking for help from others, or supporting other people we see who are most at need, and that includes seeking professional support. So I think it's really about being able to accept mental health as something that is not a luxury, but that it is a basic need for all of us, and something we can feel okay about seeking support for, and recognize that it's okay to support others as well.
Thank you so much, Brandon, for also offering ways we can support each other and provide help, and the importance of it actually, and recognizing when the help is needed. And as I said, we are in the third year of pandemic that has impacted all of us. But unfortunately, some people are experiencing additional crises to the pandemic, like the pandemic is not enough, and living in conflict areas or in the middle of the war. So this is why we have Fahmi and Selma today as well. So Fahmi, maybe you can tell us a bit, also in the light of the current situation in Ukraine, how such events or living in such environment impacts people's health.
Alex, thank you so much for this question and for having us. Sadly, and as you would expect in armed conflicts, as well as in other humanitarian emergencies, stressful experiences are common. People will be exposed to violence, separation from loved ones, separation from their belongings, difficulty in accessing basic needs, and many security issues that make the situation really stressful for them. And because of this, psychological distress is common and normal, and people can have reactions which are temporary, such as difficulty in sleeping, sadness, helplessness with the situation, sometimes anger even, or irritability. But many of these actually are normal reactions due to abnormal situation and will go with time for many people. But how people react on the intermediate and also on the long term really depend on many aspects, including the situation itself, the resilience of the individual, the previous and current mental health status of the individual, as well as the availability of social support for the person. But let me share with you number of facts about mental health and emergencies. So we know based on WHO projections that the risk of developing a mental health condition after an emergency increase. Conditions such as depression and anxiety have the likelihood of being doubled after major emergencies. And globally, our estimates that 1 in 5 people after an emergency would be suffering from a mental health condition such as depression, anxiety, post-traumatic stress disorder, schizophrenia, or bipolar. 1 in 5, 22.1%. Second fact, while we are talking about the risk of having new mental health condition, we all should not forget the people with pre-existing mental health condition, even before the armed conflict or a humanitarian emergency. Just imagine a person with pre-existing anxiety or depression exposed to all these stressors that can increase their symptoms and maybe cause relapse. Also, there is disruption of the services. So people with pre-existing mental health need is a very vulnerable group, particularly those who are also in institutions for which many times their basic needs sometimes are neglected during humanitarian responses and should be priority for all humanitarian actors. And finally, as my colleague Brandon has mentioned, while we are talking about humanitarian emergencies at this moment of time, most of humanitarian emergencies are coming off top of an existing public health emergency, which is COVID-19. And due to limited investment in mental health services before the pandemic by many countries, the mental health services are left exhausted, overwhelmed, and in many countries insufficient to address the needs for both the humanitarian emergency as well as the public health emergency. Thank you, Alex.
Thank you so much, Fahmi. And as we have Selma on the ground in Poland, where large majority of refugees from Ukraine are going. So, Selma, can you tell us maybe what are the immediate needs when it comes to mental health among those refugees who are large majority, I think, women and children and elderly?
So as of today in Poland now we have 2 million people coming from Ukraine, and the majority are, I mean 99% are women and children. We see very few men, elderly and people with disabilities. When I talk to people, the refugees themselves and the service providers, they named mental health as a priority concern. And the reason for that is there is great solidarity and support from Polish people, with a lot of volunteers. They are covering all the immediate needs, all the basic needs, from clothing to temporary accommodation and food and the medical care. So about the essential mental health needs, we want to think of mental health needs in layers. So providing accommodation and basic needs and food to people is also supporting their mental health. So what we are trying to do now is understanding and accepting, like Fahmi mentioned, that people are exposed to adversity and they are distressed. But the first thing we need to do is not pathologizing their situation with trauma, using the word trauma, but supporting them with their basic needs first and providing them space to express themselves and listen to them and apply psychological first aid, which is an approach with key principles of looking, listening, and linking people with the basic needs. So this is the number one thing now. And I can also add that people right now are in the middle of this transitional period. When they arrive in Poland, when they need this great solidarity and their basic needs being attended, they have still two main worries, and those are what is going to happen to their loved ones back home and what are they doing next. So people are still having very practical issues to deal with, and this should be our first support mechanism to people.
Thank you so much, Selma. And we've seen all over our social media channels that picture of you hugging a student refugee. So maybe you can tell us about that story.
Actually, she just emailed me just before this call, and I was so happy. And so she found a relative, and she's staying with them. So she was a medical student, and she had to leave with her family. She's the eldest child with her mother and sister and brother, and she had to leave her studies. So it was quite touchy, and she was asking me very simple advice on how she deals with this kind of situation, the distress she's going through and her family going through. So I try to listen to her and try to give her some very simple advice on continuing doing what she does for relaxing, and make sure she eats well, she sleeps well, and reduce exposure to social media as much as possible, and try to take it day by day, basically.
Thank you so much, Selma. And I'm glad actually you mentioned that exposure to social media. It's as much as it's important to be informed on what's happening, and also social media do and digital technologies do allow us to stay in touch in such moments with our loved ones. But on the other side, that the level of information and news can be harmful in a way, as we can't keep up with all of that. So do you have any advice as well, how we can maybe make a pause, or what to do to limit the level of information so that we can maybe limit the levels of stress?
Keeping a routine is very helpful, and developing a routine if possible. In the reception centers I visited, I saw some very courageous, very resilient women who were trying to continue attending their own needs, their self care first, so they could continue providing support to their families. Um, so that means, I mean, it's very difficult, yes, to reduce the time spent on this, but maybe connect with family, get directly, get the information from them, and then just try to limit it by having other activities to keep focus, to keep focus, because they are still on the go. They are still in a transitional period. They need to find their next destination. So
Thank you so much, Selma. Fahmi, we're getting some questions from our viewers about mental health needs or consequences in those conflicts that are prolonged and lasting long. And we have many more than Ukraine, unfortunately, Syria, Afghanistan, Ethiopia. So as you recently came back from Afghanistan, maybe you can tell us as well what are the needs there, but in particular, what are the consequences when people are living in such conditions for a long time?
Thank you, Alex. Great and important question. WHO support all countries affected by emergencies, including Ukraine and many other countries affected by acute and protracted crisis. It is right. I was in a 3-level WHO mission to support Afghanistan in its mental health needs. And usually, what WHO do at any when we receive a request to support a country in any emergency is that first we coordinate with all actors globally and at country level, to make sure that we are aware who is doing what, where, and when regarding the mental health need of the population. We also make sure that technical guidance become available in local and relevant languages. In the case of the Ukraine emergency, that's making sure that all materials are available, which we did in Ukrainian, Hungarian, Polish, Romanian, and other languages. And in the case of Afghanistan, making sure that resources are available in Dari, Pashto, and other relevant resources in the country, the best available evidence guidance for actors in different sectors. And then while we coordinating with actors, we try to assess using specific technical tools on what are the gaps in mental health and psychosocial needs. And when I talk about the gaps, we talk about gaps regarding specific geographical locations, specific target groups, and specific activities. and then we start to strengthen the local mental health and psychosocial response using these tools. For example, if the gap is about building the capacity of general health worker due to insufficient human resources to provide a set of base of support for common mental health condition, we start using some of the WHO tools to build the capacity of primary healthcare worker to address some of the common mental health needs. In Afghanistan, the population in needs of humanitarian assistance exceed 24 million people in Afghanistan. And if we apply the percentage I just shared with you at the beginning of this interview, 22.1, that means Afghanistan have more than 5 million people with common mental health condition. And if we apply 5.1% to this 24 million, that would be 1.2 million people in Afghanistan with severe mental disorder. Huge need and huge gap if we know that Afghanistan only have 100 specialized mental health professional, most of them centralized in Kabul. The findings of my mission include identifying and trying to coordinate for provision of some of the basic needs at Kabul psychiatric hospital. We identified also local capacity building needs by many of the local actors. But what we need to emphasize on the long term is also making sure that we build the human resource in Afghanistan on the long term to respond to the current and ongoing emergency. Thank you.
Thank you so much, Fahmi. We're getting some questions about as well discrimination during emergencies and the impacts of that, and maybe what is WHO doing to address this? And maybe we can also elaborate a bit more. What is WHO's role when emergency happens, and how to meet the mental health needs beyond what you were, Fahmi, just saying in coordination and identifying needs? Are we providing as well some concrete supports like Selma is doing in Poland? Are we doing that in other settings?
Thank you so much, Alex. We provide support to all humanitarian emergencies equally. When the emergency in Ukraine occurred, immediately WHO made available the technical resources available in Ukrainian and in local languages. We immediately deployed experts to Poland, where Salma is, but also at the same time to Hungary, to Moldova. We also started global coordination through WHO ruling, global coordination in mental health and psychosocial support together with our partners in United Nations, international NGOs, and Red Cross movement, and support country level mental health and psychosocial support technical working group. We did this in Ukraine, but WHO exactly do the same with all emergencies. I talked about Afghanistan. Our teams are also supporting major and large emergencies, doing the same in Iraq, in Syria, in Ethiopia, in South Sudan, in Venezuela, and in numerous other emergencies. And I give you the example of Syria. Back in 2011, with the start of the current Syrian conflict, Syria had only 2 psychiatric facilities, and these were the center of mental health services in all the country, one in Damascus and one in Aleppo. And during the past decade, and against all odds, and despite or because of the ongoing conflict and the increase in needs, the mental health professionals in Syria, on both sides of the conflict, managed to expand mental health services at community level to go beyond these 2 cities and to go beyond psychiatric facilities to be provided in more than 12 Syrian cities, and at the community mental health level in more than 150 centers currently. Still, this is not fulfilling all the needs for Syria, and still there is need for ongoing work, and we're doing the same coordination level with Syria and other emergencies. But indeed, we need to scale up the investment even before emergencies to make sure that mental health systems are resilient in all countries for public health and humanitarian emergencies.
Thank you so much, Fahmi. And Selma, any thoughts from you as well on our role?
Just I want to add and stress Fahmi's point on coordination. Right now, in neighboring countries of Ukraine, I think we are more than 5, 6 colleagues, my counterparts, trying to establish. We established actually mental health and psychosocial support working groups, and it's very important for different organizations who want to come and provide support to coordinate with these groups. Because there are international agencies, national NGOs, government, and then we have a lot of requests or we see their support on the ground, international professional associations and academic institutions. So it's very important to coordinate and establish from the beginning the coordination, informing each other, and not working in silos. And beware that in this kind of emergency, the way of working needs to be in line with humanitarian principles that WHO and Interagency Standing Committee developed all these guidance that are also now available in the host countries' languages.
Thank you so much, Salma. Brandon, we are also getting some questions in regard to COVID-19 pandemic and its impacts on mental health. So one question is about, we know that a lot of patients are suffering from so-called long COVID or post-COVID conditions. So do we have any evidence on what is the impact of such prolonged disease on patients' mental health?
Thanks, Alex. That's an important question, and it's one we are trying to learn more about every day. I think what we know is that COVID-19 infection itself is a major adversity, and it can be particularly adverse for people experiencing severe illness and hospitalization, and then the long-term stress and risk that comes after that with so-called long COVID or post-COVID condition. It's difficult to know exactly which symptoms are mental health symptoms are part of post-COVID condition. We're still working to learn more about that in the literature and to clearly define what post-COVID condition entails. But we know things like depression, anxiety, those are common symptoms people experience after adversity. And it's also true that those are commonly experienced after COVID-19 infection among many people.
Thank you so much, Brandon. We are also getting a question from Professor Sami Azer. Do we have evidence that mental health is still a challenge in COVID-19, or we have overcome this stage? What evidence do we have in this area? And I believe this is in the context that in some countries, measures are lifted, and we have this impression that COVID-19 is over. Well, unfortunately, we still have high rates of cases circulating globally.
Yeah, I think when we come to mental health and the impacts of COVID-19, we know they're quite large. And this is based on data on mostly 2020 and 2021, the first half of 2021. So those impacts are large, and I think there's good evidence to indicate that they may be increasing. And we may not have seen the worst of it when it comes to mental health impacts yet. I think when we talk about mental health, we're seeing through COVID-19, there are a lot of long-term implications here, such as the economic impacts on people and their livelihoods. So those symptoms will continue to play out, and we don't know exactly what will happen with what we have currently in the data, but I think there are reasons for concern. And as we mentioned earlier, we still know that worldwide, governments spend very little on mental health services, just 2% of health budgets. And that's been the case for a long time. And COVID-19 has only made the gaps in access to services in many countries for people who are suffering, people in need, only has made it wider. And so we know that mental health will certainly continue to be something that should be prioritized in response to COVID-19 and in recovery and when the world enters recovery from the pandemic.
Thank you so much, Brandon. Fahmi, do you have any thoughts as well?
Thank you, Alex. I while listening to this important question, I was thinking of humanitarian contexts with extremely low resources, such as in South Sudan. South Sudan, like many other countries in the world, its own COVID-19 outbreak. But South Sudan is a country almost in the size of France, with a population of 12 million people approximately. But only have two specialized mental health professionals, only two psychiatrists serving the whole population of South Sudan. And these two specialized mental health professionals have to cope with the daily needs On top of that, the increase in need and also the service disruptions due to COVID-19, and on top of that, the humanitarian needs because of the armed conflict in the country. For countries with extremely limited resources, and that to apply, unfortunately, to all countries with humanitarian emergencies, we need to invest on systems before the conflict for preparedness, but also now. We urge governments, we urge donors and humanitarian actors to consider mental health and psychosocial support an integral component of their packages of humanitarian support to countries that apply to health sector as well as other sectors.
Thank you so much, Fahmi. We are also getting some questions about who are the vulnerable groups, and in particular among the people who are displaced. Are children the most vulnerable, or which groups do need our support the most?
Should I answer?
Please go ahead, Salma.
So, particularly in Poland, right now, we see unaccompanied children. We see people with psychosocial disabilities, and especially the ones without caregivers, um, elderly people, and carers for people with severe mental health conditions. So those are the groups now specifically that we saw so far in Poland. But maybe Fahmi could add more.
Thank you, Salma. I totally agree with you. But also thinking of the people inside Ukraine, and including also many of the displaced Ukrainians, people with pre-existing mental health needs, those who have the service disrupted, exposed to more stresses. This is a very vulnerable group now, knowing that the percentage of this population group is already high in all countries. So among the displaced population, all actors need to prioritize the need for those with pre-existing mental health condition, including those at the country. Inside Ukraine, in fact have some of the largest number and also largest size and longest in stay psychiatric facilities in whole Europe. There are around 60 psychiatric facilities with more than 100 community residential facilities and more than 30 inpatient facilities for children and adolescents with mental disorders. These facilities, usually in humanitarian emergencies and particularly armed conflicts, are unfortunately subject to neglect when the staff leaves the facility, or there are challenges also for them to access the facility, and the basic needs of the residents of this facility resides on providing these basic needs on daily basis. And also we are receiving reports of some of these facilities being also exposed to attacks. So we also want to emphasize the importance of safety and protection and provision of basic needs for the vulnerable people in psychiatric facilities, inpatient within the country.
Thank you so much, Fahmi. Brandon, maybe we can also, or all of you, maybe we can also go into the signs of mental health needs. For you as professionals, it's, you know, how to recognize what are the signals and how to support someone who needs mental health service. But for regular people, how do we recognize when somebody we love or care about needs our help or needs professional help?
Sure. I can add a few signs, and I'm sure my colleagues can as well. I think one of the key signs we can notice is sleep. If we're struggling to sleep, it's a key indicator that we're experiencing stress, that we're maybe in need of some support. I think the same is true with our routine. If our routine is really disrupted and we're struggling to function in our daily life, struggling to work effectively, struggling to take care of our family, take care of our children, you'll notice these impacts, and you can notice it in others as well. There are more personal signs as well. You can notice if you're struggling to stop thinking about something that's happening or something you're worried about, struggling to focus on daily tasks. You're feeling overwhelmed. You're feeling anxious all the time, feeling depressed, feeling sad. These are key signs that maybe there is a need to reach out for support from from others, whether it be your loved ones, professionals, whatever it is that you think would work for you. Those can be key signs. I'll let my colleagues add as well.
Selma, would you like to add?
I mean, I just want to link it currently what I observe in Poland among volunteers, responders, and us humanitarian workers. We are also experiencing now a lot of distress ourselves, and it's very important to be aware of our own self care, and before they become more chronic issues, to address them immediately through those routine self care activities.
Thank you, Selma. And Fahmi, any additional comments from you
Sure,
on
sure, Alex.
signals and signs?
What what we know is that people cope better when during difficult times they have support, social support from people around them, and that's the basics of some of the interventions, such as building the capacity of all frontline workers, all humanitarian workers, on skills such as basic psychosocial skills and psychological first aid. In my opinion, what you see in the field is that what really help people most, that during these difficult times, while they're moving from a place, people escaping for their lives and leaving many things behind, is that you have someone who is willing to listen and willing to link them to practical support. The fact that a person is caring in the middle of all the chaos, which is around a humanitarian emergency or an armed conflict, about the emotional and psychosocial well-being of the person they talk to and willing to listen, make a huge difference.
Thank you. And any tips on how to help to reduce stress or anxiety? Fahmi, do you want to start?
This is the area of expertise of Brandon, so I'm going to pass the question to him.
Sorry, Brandon, the floor is yours.
Thank you. Yeah, I think when we're talking about watching or learning or hearing about these stressful situations, or if we're talking about being personally exposed, there are some things we can do. Fahmi mentioned a very important one, and that's to try to be around and be with those people we love and cherish, because I mean, we see in these humanitarian emergencies, we see in the field that those moments are precious and they can be fleeting and they can disappear in a second. So trying to seek support from people that we care about, that care about us and that we love, and then the same token, trying to do the same for those people, supporting people, listening to each other, being there for each other, being not judgmental, open, willing to care about someone and take the moment to be with them. That can be extremely important. I mentioned there are a few basic things we can do individually if we are safe, if we have our basic needs met, but we're struggling to watch from afar, seeing what's happening in the world. If we look around, we do see there are many emergencies from Afghanistan, Ukraine, Yemen. There are many places where people are suffering, and we can see this. And so it's normal to react to that, but I think we can try to limit the amount of news coverage we might watch. If it does make us anxious, we can set time aside during the day to explore that or to worry, and then try to focus in other times on the here and now as much as we can. There are strategies that work for some people, like breathing techniques, yoga, meditation, that can help in some instances when we're safe. And reaching out for professional support. I think it's really important to be okay to seek that support when you need help, and to acknowledge that it's okay for others to do that as well. And then, sorry,
please go ahead, Brandon, please.
I would just add that although there's a lot of reasons to be anxious and to be afraid and to be worried, there are also a lot of reasons for hope in the world. We see stories every day of amazing resilience by people affected by these crises, and amazing people working to rebuild communities and to save lives in response to these emergencies. So I think we can, in any way we can, try to contribute to that response and recognize the resilience that's happening. Even if we're not working in the emergency itself, we can get involved. We all have a role to play in trying to support those people in need.
Thank you so much, Brandon. Selma, any thoughts from you?
Just maybe also one thing about not to do, what not to do. We observe this frequently about increased alcohol consumption and substance abuse. So these could be like quick solutions for people to relax, but then on the long term they create more serious problems. So to be very mindful of alcohol consumption and avoid use of drugs.
Thank you so much, Salma. Thank you to the all three of you for this very important conversation and for very important advice for our viewers from all over the world. I will just name some from the UK, Uganda, Senegal, India, Iran, Argentina, Malta, El Salvador, Cambodia, Ghana, Sierra Leone, Guatemala, Palestine, Spain, and many others. So thank you for your questions and thank you for being with us. I thank to our experts for their amazing work. And Selma, thank you for taking care of people in Poland at the moment. And Fami, please keep us posted on other missions and on how we are supporting people. And Brandon, for all your great work. As our COVID-19 experts are saying, the pandemic is not over yet. So we still have work to do there and to support each other as well when it comes to mental health needs. So I thank you, all three of you, once again, and goodbye.
Thank you so much.